COVID-19 vaccine. This is sponsored by the Jane Finch Church Coalition. The coalition has been in existence since 2002. The coalition consists of a number of churches representing different denominations and one parachurch. Our motto has been working together to transform our community. So recently, the focus has been areas such as food security, elder care, police relationship, and education, equipping our parents to become advocates for their children. So we are thankful that we are able to work together, not only as churches, but to work together in the community with institutions and organizations like Black Creek. Because together we are seeking to live out our motto, working together to transform our community. So this exam is even an example of this partnership that we are striving to have as we work together as churches in the community. So we're thankful for Black Creek under the leadership of Cheryl Prescod for us to hold this information session. Thank you, Cheryl and staff, for the part played in making this evening possible. My name is Audley Goulbourne. I'm a pastor in the local church. And so I welcome each one and turn over now to Cheryl to give us some housekeeping details.
Okay, thank you so much, Audley. I'd like to take the opportunity to thank you and your colleagues for this collaboration. Without our partners in the community, we could not have a healthy community, which is the vision of Black Creek Community Health Center. And throughout the COVID crisis, we really depended on relationships. And these are not new relationships. We have worked with Pastor Audley, with the Friendship Community Church, with the Agape Ministries, and other churches in the Jane Finch community for quite some time, because we know that we could, alone we can't achieve the goals that we need to achieve. And throughout a crisis is the time that we really have to come together as a community. So again, really thankful and to have this opportunity, and for all of you for joining us this evening. A special thanks to our guest speakers, who I know are very busy as well in their day jobs, but they take the time out to help us understand what's been happening with the COVID virus, the development of vaccines, and just a lot of what's going on, and sharing information about the vaccine in the community. So before we get started, just a few housekeeping details. By now, I'm assuming everyone is comfortable with Zoom, but for some of you that maybe you are not as comfortable, just a reminder to put yourself on mute so that we could all hear each other when we're speaking. If you would like to speak and you don't have the option of the chat, please use the chat function and type in your comment or your question. You can also use the reaction buttons to applaud or to give us a thumbs up if you hear something that you like or anything else. Let's see. For those of you on the phone, for you to unmute, you will have to press *6, and we will hopefully be able to hear your question. A reminder as well that this session is being recorded so that we can have access to it to listen and continue our learning about the vaccines. It's also being live streamed on Black Creek Community Health Center's YouTube channel. And we'll put the details of that in the chat later. And I think that's it. So without any further ado, let's get going. The agenda for the evening is that we will be hearing from first Dr. Upton Allen, and Audley will introduce Dr. Allen in a moment, about some of the fears and concerns about the vaccine. We will then hear from Dr. Jerome Liu about the development of the vaccines and what's available here in Canada today. And finally, from Dr. Nicholson-Baker about how to take care of ourselves throughout this crisis. And then we'll be having a poll. And at this point, I will turn it over to Michelle to launch a poll, because we'd like to know how people are feeling about the vaccine before as you go into the session, and we'll be launching the poll again at the end of the session. So Michelle, over to you for the poll.
Great. Good evening, everyone. I'm Michelle. I'm with Black Creek Community Health Center, and we're going to be launching a poll. So for those of you who are attending on Zoom, you're going to have a little pop-up that comes up, and we just want to ask a question. If you were offered the COVID-19 vaccine right now, will you take it? And the answers are yes, no, and unsure. So I'm going to be launching the poll now. We'll give you a minute to respond, and then we'll share our results. For those of you who are on the phone, we'll have a chance for you to share feedback afterwards. So I'm just launching the poll. So we've got about 48 people joining. The poll has been launched. So you can just pick the response on your screen. It's yes, no, or unsure. Do people see the poll? Just for our panelists, do you see the poll?
Yes.
Yeah, okay. All right.
Will you take it?
Unsure. Okay, I'm not seeing any responses yet. We'll give it another minute. If you're seeing the poll on your screen, you just pick the answer, yes, no, and then you can hit submit.
Where's Danny? Yeah?
Michelle, I'm seeing poll results. I'm not, okay, I don't think we can vote, that's why. Okay.
Okay, let me, do I need to launch it again maybe?
We're not seeing Danny's face properly.
The number is going up. We have 33 and 45.
Where's she going?
Just a reminder
still there?
to mute yourself.
Yeah, you can mute yourself, please. Sure, are you seeing the results? Or seeing?
I am.
Okay, great. Maybe it's just me on my end then.
So we've got 70% of those on the call. At this point, 72. Okay. So let's give it another few seconds.
Okay. So when you're ready, just I'll hit end poll, and maybe one of us can share the results with everyone.
Okay. So I think it's been about 2 minutes. I'm thinking I don't see any other, the numbers going up, so you can end the poll and the results are there.
Do you see results?
Okay. So the results are, we have 51% at this point saying they're unsure whether they'll be taking the vaccine, 14% who are saying no, they will not, and 34% yes. Okay, so just, if I will write this down, and we will review at the end to see if there's any difference after we've included the session. Thank you so much, Michelle.
Thank you.
I'll turn it back over to Audley to introduce our first speaker.
All right. Welcome to Dr. Upton Allen, the first presenter. You'll have 10 minutes to present, and then we'll have some time for questions after. Dr. Allen is a professor of pediatrics at the University of Toronto. He's a chief division of infectious diseases and senior associate scientist in the Research Institute at the Hospital for Sick Children. He's also a professor with Institute of Health Policy, Management and Evaluation at the University of Toronto. Dr. Allen is the past director of the Infectious Diseases Society of America and fellow of the society. At Sick Kids, he's a leading research study, conducting large-scale antibody testing and data collection of Black Canadians in Ontario. The goals of the research team are to understand the prevalence of COVID-19 infection in Black Canadian communities, the level of immunity to COVID-19 within these communities, sustainability of immune responses, and the risk factors associated with infection. In 2018, Dr. Allen was awarded the Order of Ontario, which is the highest honor awarded by the province of Ontario. Well, this evening, Dr. Allen, I'm awarding you the Order of Jane Finch. Thank you for coming to take this time to share with us. Over to you now, sir.
Thank you very much. It's an honor to be with you. I'm going to try to share my screen because I thought maybe I'll share with you a few slides to frame our conversation. And let me know if you can see my slides. Can you?
Yes, we can. Oh, well, in a minute we will.
Okay.
We see a blank slide.
There you go. Yeah.
Okay, perfect. All right, great. So let me now put it on slideshow. Can you see that?
Yeah.
Yes.
Yes?
Yes, yes.
Wonderful, wonderful. So, you know, COVID has been really stressful for all. And so I always take time out to remind everyone to identify things that allow you to relax at times, you know. And so I try to look at photos of beautiful scenery around the world, but particularly the Caribbean. This is a photograph of my hometown in Portland, Jamaica. This is Port Antonio. And it's also an opportunity for me to show off the next slide, which is one of the schools that I attended, Titchfield School in Port Antonio, located on the peninsula of Port Antonio. But the real reason is to point out that it has its own white sand beach. And so there are very few places like that. But it allows me to think in a wishful way that there was no COVID and I could travel back to the Caribbean. I wanted to share with you this and other slides that, you know, highlight a few things that we'll come back to. We've heard a lot about SARS-CoV-2, the causative agent for COVID-19, but altogether there are 7 members of the coronavirus families. And the ones that are problematic are the bottom 3, MERS coronavirus, SARS-CoV-1, and then of course SARS-CoV-2. The ones in red are the seasonal coronaviruses, and they appear just about every year. And I'll come back to this slide in a moment, but SARS-CoV-1, if you recall, started in 2003, 2004, occurred 2003, 2004. And the relevance of that to what's happening today with respect to vaccines, I will come back to. We know that several factors have been associated with an increased risk of COVID among racialized communities, including Black communities. We know that this has been related to discrimination, including racism. There are issues with respect to differential access to healthcare and how healthcare has been utilized, the types of jobs that people do that put them on the front line so that they're exposed more likely. And some people, frankly, have to do 2 or 3 jobs just to make ends meet, and that doubles or triples their exposure. Then the types of income capabilities that they have that puts them in occupations that don't allow them to work from home, for example. And then, of course, affordable housing and the issues around having multi-generational homes with many people. So there are several factors that have been identified as being associated with an increased risk of COVID in the United States, in the UK, and we believe in Canada as well. I wanted to show you this particular slide because it relates to the Tuskegee experiment, but I'm showing it for you for a couple of reasons. And just by way of background, this was a natural history study of syphilis that started in the 1930s and continued to 1972. And Black men in the United States were followed without a treatment for syphilis. They entered the study just before penicillin was available. And when penicillin became available, they were not offered treatment. And so this has led to a tremendous amount of lack of trust of the healthcare system in the United States. 2 points I want to make about this. Number one is that this is often stated as one of the reasons why several individuals within the Black communities in Canada are not having a high level of trust of the healthcare system. But, you know, in discussing this with a number of individuals, and I had an opportunity to talk to some folks recently, some young men, and when I asked them if they had ever heard of the Tuskegee experiment, none of them had. And so the point is that we need to recognize that there are other reasons why people are reluctant to be vaccinated. And so we need to try to get a better understanding of those reasons and don't think of any one particular reason. The other thing I want to bring out is that the woman on the right is a Black woman, obviously, and she was a coordinator of the project. And so bottom line is that certainly within the Black communities and within racialized communities, while it's important to have individuals who look like the communities that they're working in, that alone is not enough. One needs to work with them to build trust so that they trust the system. And as healthcare workers, often we are seen as part of that system. And so we have to try to earn their trust. I don't need to tell you guys about this data. You know this, but just to put things in context, the increased burden of COVID among certain ethno-racial groups in the Toronto area. The mustard color represents the share of the population. The gray color represents the share of COVID. And as you can see on the right, white population just under 50%, 17% of COVID cases. Blacks, that's 9% of the population, 21% of COVID. And bottom line is that if you look across the groups, East Asians and whites are the only groups where the mustard color exceeds the gray color. All other groups are disproportionately represented. And we've seen in the area of Peel, where the population breakdown is a bit different, we see South Asians are disproportionately represented among COVID cases. Now, I recognize that we only have 10 minutes, but I just wanted to highlight a few things. Several questions often come up relating to COVID within the Black community and within racialized communities. And people often ask, well, why prioritize Black people and other racialized groups? And the bottom line is that these groups are disproportionately represented, but it's really important that people who are in the business of rolling vaccine out to these communities do so in a manner that clearly communicates a reason for this, so that people don't think that they're being prioritized so that they could be used as guinea pigs, but rather they're being prioritized because that's where the burden of the illness related to COVID is occurring. And so you want to protect people who are most frequently affected. The second bullet point relates to the question, were Black people included in vaccine studies? And the bottom line is yes. In the Mrna study and the Pfizer study, about 10% of the study population were Black. What are the ingredients in the vaccine vials? There are new vaccines coming along, but what I can tell you is that for the Mrna and Pfizer vaccines, the ingredients are pretty simple. It's fat, a lipid, we have some sugar and water, some salts, and then the mRNA. There's not a lot more than that. And so, which is really cool because they don't have preservatives, for example. So it's really not that complicated. And the way that I think about it, it's like, a chocolate covered raisin, and where the mRNA is a raisin and outside is a fatty layer. Will DNA be changed by the mRNA vaccines? This comes up a lot, and the bottom line is no. The cells in our bodies do not have the complex systems of enzymes to even consider making changes that would allow for there to be alterations to our DNA when we get an mRNA vaccine. So it just doesn't happen. But then also, how were these vaccines developed so quickly? And this is where I want to come back to. The bottom line is on the left, you see in an ideal world, when vaccines are developed, the process could take a decade. Not necessarily an ideal world, but in the usual world, a decade. We were fortunate with COVID, so that when COVID-19 came along, COVID-19 into 2020 came along, work had been started on SARS-CoV-1 and MERS going back to the early 2000s. So remember I said that SARS-CoV-1 occurred in 2003, 2004. Right after that, work had started on SARS-CoV-1, which is a close cousin of SARS-CoV-2. MERS as well, which is another cousin of SARS-CoV-2. And then the seasonal coronaviruses that I made reference to, work was being done on those viruses with respect to vaccines. And so when COVID-19 came along, it actually was a good news luck story for us as human beings. That fortunately, what was happening is a decade of work had already happened. And so we were just lucky. In fact, it's in a really interesting way, COVID benefited from the fact that SARS-CoV-1 happened in 2003, 2004. The other point is, if you notice, there are different phases, and typically what happens, each of these phases runs for at least 6 months, then you wait, and then you start again, then you wait. And you can see that could take a couple of years or more. What happened was that they overlapped the phases. And then also what happened as well is that typically in vaccine trials, the regulatory guys like FDA and Health Canada are provided information when everything is all done. What was happening, because we're in the middle of a pandemic, was that the manufacturers, the people doing the research, started providing FDA and Health Canada information as it came off the press. So phase 1 information, they saw that 2 and 3 and so forth, so that at the end of it, they were much further ahead. So the process was different, but we benefited from more than a decade of research that was going on before that. So with that, I will stop. Thank you.
Thank you, Dr. Allen. We have some minutes to answer any questions that you may have for Dr. Allen after the presentation. So are there any questions there? Or chat room is being monitored. The questions to be put on the chat room.
Reminder, you can raise your hand through the reactions button.
Hello.
Go ahead.
Hello.
Hello, the question?
Hello. Good night.
Good night, we can hear you.
Do you have a question?
Just want to ask one question, please.
Go ahead.
My question is, I am in the lot where I can make up my mind if I really would want to take the vaccine, because I am thinking that they had 3 different kinds of vaccine, and now I think it's 4. And what if I take one now And then when the time comes, the weeks pass by when I'm to get the other one, they give me a different one from the one that I take now. Isn't that going to affect me, or does it work?
So that's a really great question. So what will happen is that whatever you get started on, that's what you're going to get finished on. But research is being done. Yes, research is being done to determine if one could mix them. But so far, we don't have that sort of information. So whatever you get started on, that's what you're going to get finished on.
Okay, thank you.
Welcome.
Hello.
Hello, may I ask a question?
Yes, I work in the
hospital.
Dr. Allen said that it was not only because of the trust or the mistrust in the healthcare system coming out from the Tuskegee experiment, but there are other reasons why people are uncertain of taking the vaccine. Could he give some of the other reasons other than the lack of trust?
Yeah, so that's a great question. In my own mind, I have broken down the reasons for vaccine hesitancy or reluctance as being related to three main factors. One is access, where there are some people who, the only issues is that they're concerned that, if I have to go line up for a vaccine, I can't be bothered, I'm not going to take that. Or I have to take time off from work. I don't know if I'm going to get paid. And that applies to some people and in some jurisdictions more than others. So that's one factor. Another are beliefs, the individual beliefs as well as their particular religion. Those are factors that sometimes influence why people are reluctant. I have people I know in the United States, for example, who are healthcare workers, no problem with access, a lot of confidence, but they are of the particular religions that make, where some of the leaders are not so sure about vaccine. And then the third relates to confidence. So confidence is due to several factors. Lack of trust is one of them, but there are other factors that are built into that can drive hesitancy. So I refer to the whole issue of hesitancy or reluctance as A, B, and C: access, beliefs, and confidence. Those are the three things that I say we need to work on to fix the issue of hesitancy.
And Dr. Allen, perhaps related to that, concerns that one questioner is, what about reports of fetus particles being in the vaccine?
So that's another great question. Bottom line is that that's not the case. Where that comes from is that in some vaccine research, not for the Pfizer and Mrna vaccines, but in some vaccine research, when the vaccine has been developed to test that the vaccine is safe, they will work with different cell lines in the lab to test to see that the vaccine is safe. So for example, viruses need cells to be able to grow. And so what they would do to make sure that the vaccines are not contaminated, they would take the vaccine and inject cell lines to see if there's any viable virus there. If there's viable virus, which usually there isn't, then the cells will become infected, and you can tell that. So that's not in the vaccine development, it's researchers using cell lines. And it happens that one of the cell lines that has been used was originally derived from fetal cells, some almost 40 years ago or more. And so that's where that came from. But the vaccines don't have fetal cells in it.
And several related questions to the effectiveness of the vaccines, as there are different strains that we're becoming aware of. And does one vaccine prevent you from getting these other strains? Will all of them have that effect?
Yeah, you know, that's a really great question. It's an important question, and we were all concerned about that. And it's certainly something that we have to keep monitoring. But we're really lucky with these, especially the first two vaccines that came out, and certainly even the more recent ones, that typically when vaccines come out and are on the market, especially against the respiratory viruses, their efficacy is more like 70% or so. Moderna and Pfizer came in at 94, 95%. And so if the new variants that are emerging knock off 20% off that, you're still left with a superb vaccine. So it's like going from being, you know, outstanding plus to being excellent. And so I think we'll be okay. The other point as well, especially for the Moderna and the Pfizer vaccines, it is possible to literally develop a modified version of those vaccines literally overnight in response to a new variant that emerged that people hadn't thought of. And if it's for whatever reason, it shows that the vaccines aren't as perfect as we want them to be, they can be modified. But that's a great question.
And side effects too, are they able to target it or notice anything now?
No, yeah, these vaccines are coming in, to be honest with you, as being among the safest. Networks are being set up to monitor side effects, you know, as we speak, just to make sure that there are no side effects that are being seen rarely. But the key is that if you don't see major side effects in the clinical trials, where you have like 30 to 37,000 people studied, it means that if those vaccines are associated with side effects in real life, they're likely to be very rare. That's really an important point. So far, we're lucky in that these vaccines are coming in as being incredibly safe. In fact, especially for the first two, somebody asked me where I felt they ranked in terms of safety. And I said, based on all the vaccines that we've used and are still using, on a scale of 1 to 10, where 10 is the best and 1 is lousy, these vaccines are about a 9. They're like, they're really up there. And so we're kind of really lucky, to be honest with you, so far. But we need to continue to monitor to detect rare side effects.
Thank you, Dr. Allen. We will have time, if we are able to, answer more questions at the end, but we want to give each presenter an opportunity to share and then to have questions again. So put a question in the chat room. If not answered now, will be answered later on. So over to you, Cheryl, to introduce the next speaker. Thank you.
Okay, so thank you. And it's really great to see all the questions coming in. It means that people are quite engaged in this conversation. And I hope that we can answer some of the questions within the next presentation. So at this point, I'd like to both thank Dr. Upton Allen and now introduce Dr. Jerome Liu, who is a family physician working out of Black Creek Community Health Center. For the last 5 years, Jerome completed his medical school and family medicine residency at the University of Toronto. Outside of his clinical work, he also holds the position of clinical adjunct lecturer at the University of Toronto, where he currently teaches medical students. And I know that Dr. Liu is one of quite well-liked physician at the center and very knowledgeable about the community that we serve. So I'll now turn it over to Dr. Liu.
All right, thank you, Cheryl. I appreciate that introduction. And let me just get my presentation going. So there's a lot of information. I think the recordings will be available after, so you can always check my slides later on. So first off, I have no conflicts of interest to disclose. I have no relationship with any pharmaceutical companies. I'm only paid for my work as a family doctor at Black Creek Community Health Center and for teaching medical students at the University of Toronto. Just a disclaimer, information is changing constantly. So our information about the coronavirus, about COVID-19, about the vaccines. So just to let you know, the information you're going to see here are up to date, roughly as of last week, because I needed to finish the presentation before talking to you guys today. So let's get into it. What COVID-19 vaccines are available? So as you've probably heard, we have 4 now. The first 2, Pfizer, Moderna, I think we've known about them for the last couple of months. People have been hearing about it in the news, reading about it in the news. And AstraZeneca was approved February 26th. And then literally this past Friday, Johnson & Johnson was approved by Health Canada on March 5th. We have a few more down the pipeline, but today's talk will mainly focus on those 4.
Okay.
So I think a common question people have is, how do the vaccines work? So first I'll talk about Pfizer and Moderna because they're similar in that they're both what we call mRNA COVID-19 vaccines. So this is the SARS-CoV-2 virus particle. It's what causes COVID-19. And what scientists did was they took the spike protein, which is on the outside of the virus, and found the instructions on how to make it. And we'll call those instructions mRNA, also known as messenger RNA. And they put those instructions into lipid nanoparticles and created the vaccine. So when you get injected by the vaccine, the outer lipid nanoparticle allows the mRNA instructions to enter the cells of your body. Then your body converts these instructions into just the spike protein. And this protein is put out on the outside of your cells, and then your own immune system recognizes this protein from the virus and creates an immune response, creates antibodies, develops a defense. So that next time when you actually see the real virus in the real world, it can mount a faster and stronger defense against it. And so I want to reassure people, you are not getting the coronavirus in your vaccine injection. You are literally getting the instructions to make the spike protein, okay? So that's the mRNA vaccines. Now let's talk about the other 2, the 2 newer ones. AstraZeneca and Johnson & Johnson are both what we call viral vector vaccines. And so what they use is they use a adenovirus from a chimpanzee as a transport system. So they use it so that they can transport instructions to make that same spike protein. So with these vaccines, they transport DNA instructions just for the spike protein, which get converted into mRNA. And if you recognize it, mRNA was from the last slide, the same process happens. That mRNA is converted to the spike protein. It's put up on the outside of your cells, and your own immune system recognizes it so that you can build a response. And next time, your response when you see real coronavirus would be stronger and better. So just to point out some similarities and differences, I've already talked about a couple being mRNA and a couple being viral vector. We'll talk about the ages later, but basically Pfizer is 16 years and up, and the other 3 are approved for 18 years and up. The major change with the Johnson & Johnson, which was approved last Friday, was it's 1 dose. And that's huge because if you can imagine, there's 30+ million people in Canada, there's 3+ million people in Toronto, and then if you include the GTA, it's a lot more people. To arrange 2 appointments for every person, 3, 4, or 12 weeks apart or 4 months apart would be a big, big task. But if you have a 1-dose vaccine, similar to the flu shot, you come in 1 dose, you go. That is ideal, and Johnson & Johnson has brought that, so that's a big thing. The other thing is, I'll just briefly mention that Johnson & Johnson and AstraZeneca, they're easier to store. We just use normal fridges. You might have heard that Pfizer and Moderna require freezers, and Pfizer are very, very cold freezer, down to -80 degrees Celsius. We don't need those kind of storage temperatures with the AstraZeneca and Johnson & Johnson. Just a thing to let you guys know, you may have heard that there have been new recommendations to help more people get vaccinated. A lot of provinces are moving to potentially increase the interval between the first and second dose of the Pfizer, Moderna, and AstraZeneca. So you might find out soon that you might be getting your first dose and actually wait 4 months for the next dose instead of the traditional 4 weeks. And a lot of places have already started doing that. BC, British Columbia, and Quebec, Israel started with vaccinating everyone their first dose. So, and where the early data shows that the immunity in the first couple of months is pretty good. So I think in the chat, there were some questions about effectiveness. So I'll address some of it here as well. As Dr. Allen mentioned, Pfizer and Moderna are both 94 and 95% effective at preventing COVID-19 symptoms. AstraZeneca, 62%, and Johnson & Johnson, 66.3. So that might make people feel like, oh, you know, maybe I should wait for the Pfizer, wait for the Moderna. But the most important thing that we found is all 4 vaccines are effective at preventing severe illness and death. And that's the main outcome we want from vaccines. We do not want our hospitals filled, emergency departments filled with people, ICUs filled with people. I think we can all remember the sad events in Italy, for example, where their hospitals were filled. There were not enough space. People were sent home even though they were still very sick. We don't want that. You know, if you take the Johnson & Johnson, it's 66% effective. So that means that maybe a lot of people might still have the sniffles and mild sore throat. That's okay, because all 4 are very good at preventing you from needing to go to the hospital and stay at the hospital because you're so sick. So remember that, okay? The other thing to remember is that the maximum protection comes 1 to 2 weeks after you get your dose of vaccine. And if it's 2 doses, the max protection is after both doses. Another thing to remind you guys is when you get the vaccine, it's about preventing you from feeling sick and needing to go to the hospital. So far, we don't have good evidence that it prevents you from spreading it. So if you've gotten your vaccine, you still need to wash your hands, wear a mask, physically distance, because you may have it in your saliva when you talk, you may have it on you, and you may not feel any symptoms because you had the vaccine, but you may spread it to other people. And so to protect your loved ones, protect your friends, your coworkers, please continue to follow the public health measures. Briefly about the variants. There are 3 variants, as you guys know, that variants of concern that we've identified: the UK variant, South African, and Brazilian variant. And there is concern that, you know, will our vaccines be as effective? Because a lot of the vaccines that we've studied to date were made using, you know, the spike protein from the original virus. We haven't adjusted things just yet. So ongoing research is being done. There's some modeling that suggests, for example, that the UK variant may become dominant in Toronto. So that part of, you know, the research that we're all doing is just to see how these vaccines will hold up. There are promising early results that the Pfizer, Moderna, and AstraZeneca vaccines are decent against the UK variant. And of note, Pfizer and Moderna have mentioned that they are working on developing possible booster vaccines to improve protection against these variants. So can I choose which vaccine I receive? So, you know, there's 4 vaccines and maybe you have a preference for one reason or another. Unfortunately, no. Generally, vaccine clinics will administer whichever vaccine they have available because they're trying to get them out as quickly as possible into people's arms as quickly as possible. So you need to remember the best vaccine is the vaccine available to you right that moment. Each day that you delay and don't get the vaccine is one more day that you could be at higher risk of getting sick and needing to go to the hospital. And remember, it takes 2 weeks to get max immunity after you get the shot. So don't wait. If you're in the clinic, the vaccine clinic, and they have a vaccine ready, take it. So who can get the vaccine? So for Pfizer, 16 and up, these are general, you know, guidelines on who can get the vaccine. If you have specific questions, I would advise you to ask your primary care provider, family doctor, or your specialist, because it'll be hard to make a slide about every person's individual health situation. But in general, the Pfizer is authorized for above 16, Moderna above 18, AstraZeneca above 18 until 64. And that's not because it's not effective above 65, it's because we don't know. The trial for AstraZeneca did not have enough 65-plus-year-olds, so it's more like we're waiting for data to see if it's effective above 65. And then Johnson & Johnson's approved for above 18. If you're 12 to 15 years old, you could talk to your provider about whether you want to still get the vaccine. There is a Pfizer trial ongoing about that age range. Health Canada has been reported to have approved a clinical trial for the Johnson & Johnson vaccine for 12 to 17-year-olds. If you're pregnant or want to become pregnant soon after the vaccine or are breastfeeding and you want to discuss it with it's recommended you discuss that with your family doctor before you get your vaccine. There is an ongoing Pfizer trial with volunteer pregnant women in it. And if you have an autoimmune disorder or a weakened immune system because of an illness or because of treatments you're receiving, or you have a bleeding issue or bruising issue, please talk to your family doctor first. Of note, delay the COVID-19 vaccine if you've received a different vaccine in the last 14 days, like any sort of vaccine like tetanus or flu shot or something like that, or if you're sick with COVID. All right, so who should not get the vaccine? So really quickly, obviously, if you had a really bad reaction to the first dose, assuming it's a 2-dose vaccine like Pfizer, Moderna, and AstraZeneca, do not get the second dose. Talk to your doctor. If you have a known allergy to any of the ingredients, then don't take the vaccine. Here is a table from the National Advisory Committee on Immunizations about the common allergens that could be in the vaccine. So for Pfizer, the most common one would be polyethylene glycol, but that's found in many things such as over-the-counter cough syrup, laxatives, and other medications. Moderna also has the polyethylene glycol. It has something else called tromethamine that may be a relatively common allergen. And AstraZeneca and Johnson & Johnson have polysorbate 80. So if you're allergic to something in the vaccine, it's probably one of these 4. So if you're allergic to one of these ingredients, just, then preferentially maybe choose a vaccine containing ingredients you're not allergic to. This next slide, don't write it down, don't memorize it. It's just to show you all the ingredients are available online. I just did quick internet searches. There's some links at the bottom. I just put it here. So if you look back on the presentation, you can quickly find the ingredients, but don't write that down. So if you had the vaccine, should you still get, if you had COVID-19 before, should you still get the vaccine? And the answer is yes. If you've had COVID-19, you've recovered, get the vaccine. There's some evidence that suggests that natural immunity from COVID-19 illness may not last very long. And there have been some reports of people potentially having COVID-19 twice, more than once. But just a reminder, do not come to get the vaccine if you are not recovered yet and if you are still in self-isolation, because we don't want you spreading COVID-19 to other people at the clinic. How long does it protect you? We don't know. Clinical trials started maybe around early March. That was for the first couple of vaccines. So we don't know how long the immunity will last for, but and we're still studying it for now. But that shouldn't change the recommendation. I would still recommend that you get the vaccine. If you get the vaccine and later you get COVID-19 symptoms, should you get tested? So let's say you got your vaccine, you got both doses, and maybe a month or 2 later, you get COVID-19 type symptoms. Yes, still get tested. None of the vaccines are 100% effective at preventing COVID-19. So there's still a possibility you could get sick. With the variants of concern, we're still studying whether our current vaccines are effective. So it could be that the effectiveness has gone down. And so maybe that's why you're developing symptoms. And you'd want to know if you have symptoms or if you have COVID-19, because if you end up testing COVID positive, you'll want to self-isolate. You'll want to protect your loved ones, your friends, your family, your coworkers, and other people. So yes, please get tested if you get symptoms, even if you've already been vaccinated. Do you need a health card to get the vaccine? And I have many patients in my practice who do not have health cards. They're non-status immigrants here in Canada. And the answer is no, you do not need a health card. If you don't have a health card, any sort of government issue ID is fine. But if you're a person who does not have any valid identification, the City of Toronto is working on a way to get you vaccinated. So stay tuned for that. Another big question is, when will I get a vaccine? It's unclear. There's a few factors. Supply is one. February was a very bad month for supply. Pfizer and Moderna cut the amount of vaccines they were going to send to us. But now the numbers are back up for Pfizer and Moderna. AstraZeneca and Johnson & Johnson have just been approved. So we're really pushing forward. We're at the tail end of phase 1. As you've heard, we're opening up mass vaccination clinics for those over 80. And then soon we'll be moving to phase 2. And they overlap a little. So it'll be quite soon we're moving to phase 2. So just stay tuned and eventually start vaccinating the general population by August. Common questions about side effects is, what are the side effects? So commonly for Pfizer and Moderna can be pain, headache, joints, pain, fevers, chills, redness and swelling at the injection site, nausea, vomiting, uncommonly enlarged lymph nodes, and very rarely an allergic reaction, a severe allergic reaction. And then other common side effects are very similar for AstraZeneca and Johnson & Johnson. Pain, fatigue, headache, chills, fever, nausea, vomiting are the most common symptoms. So lastly, are the vaccines safe? Yes. Only vaccines that Health Canada determines to be safe would be used in Canada and available in Ontario. They reviewed all the data that have included trials with large numbers of people, and all 4 vaccines have met the requirements of safety, and we're continuing to monitor adverse events. I've included here Canadian resources for the vaccinations if you want to read more on your own time. Thank you very much.
Wow, thank you, Jerome, for putting all of that together in a really nice simplified version, I think, for folks to understand easily. I'm going to ask if there's any questions in the chat first. I know that your presentation contained a lot of questions, questions and answers, so maybe there aren't too many.
Hi, Cheryl, it's Michelle. Hi. We had a couple people who had their hand up earlier, so I just wanted to give them a chance to say something. I think one of them is MVP Tom Rakosovic, if he wants to go first.
Sure, thank you. Thanks so much, Michelle. I'll just keep it quick. I don't want to take up the time from these excellent questions I've been seeing here, and I really want to thank the moderators, Cheryl, Prescod, BCCHC, and of course, Pastor Audley. We've spoken over the phone, but we don't get to see each other all that much. I really just want to thank our incredible healthcare providers in the area and our faith community. You've both been doing so much for our community as well. I know a lot of the local churches and places of worship have been doing everything from running food banks, certainly giving out information. And I think that as well as PPE, I was happy to bring thousands of masks to different places of worship as well as BCCHC. But I think this is so important. I think the lecturers have given...
Hindi pala humingi ng OHIP ang ng health card kapag nagpapavaccine. Potential talaga kayong fulfilltan nyo na lang.
Anyways, I just wanted to thank you so much for that. And I also want to say that I really appreciate the fact that a lot of the risk factors that people are experiencing...
Sana pala nakinig kayo.
La Arnie's iPhone, would you be able to just mute for a moment, please? Okay, thank you. So no, I just wanted to say that this has been really excellent presentation so far, especially for the risk factors that are being experienced within our community. Everything from people packing on packed buses, the essential workers, the frontline workers that are out there, that they're at higher risk. And that's why that I and many are fighting for targeted resources for this community, whether it be access to vaccines, everything that's come along with this. So I think these presentations have been excellent, and they've really been high up in the big details and as to why people are experiencing all the way down to the details of the vaccine. So I thank you so much. And I look forward to hearing more of these questions. Vaccine hesitancy is real, but we're really addressing this question by question. So thank you for what you're all doing. Appreciate it.
Thank you so much, Tom, for your comments and again for your support in the community and getting vaccines and testing out to community spaces actually that are accessible to folks who live in the community.
In Humber River Hospital, can we just mention Humber River Hospital has now opened their line. If I don't know if we've put it in chat, but Maria from my office is there. We could re-put it in the chat and to pre-book for special groups. Okay.
It's there. So as of today, the line has opened. I think we're having some challenges with the line, but it's open and hopefully.
Thank you so much for everything you do, Cheryl. Thank you.
Thanks, Tom.
And just before we go on, I think there's a couple of other people who've been holding their hand up as well for a couple questions. There's Kowinderjit Sindhu. Would you like to share your question or comment?
Yes, actually, I wrote the question in the chat, but anyway, I can ask now. I'm on the medication Teva Purinthol, and I left a message 2 or 3 times to my specialist. That's a liver medication. So I'm not sure if I should take for the vaccine or not. So that's why I wanted to ask my specialist, but she's not answering phone. I asked today to my pharmacist, so he said there's 4 vaccinations, so he can't say which one they are going to give me, and then he can't tell me anything. If it's going to good for me or not. So that's what I want to ask about.
So great question. And unfortunately, I can't give you direct advice about your specific situation, because I think it would be best served by talking to, if you can't reach your specialist, then perhaps your family doctor, who will know your health best and why you're taking the medications you're taking and all that. And I think they'll be better suited to answer whether it's safe for you to take. Because I think there's a couple of I think you may be alluding to whether this medication and the vaccine are safe to take together, but also there's the other question of if there's any concerns with your other health issues in taking the vaccine. So I would recommend you speak to your family doctor if you haven't reached your specialist. And family doctors do have access to something called an e-consult or OTN service. And I think there is a COVID-19 section on there, so they can ask experts for help if they can't answer your question about some of your health issues related to the vaccine. So I would recommend talking to your family doctor then.
Thank you.
Okay, thank you very much.
Thank you.
Thank you, Dr. Liu. Is there also, maybe you can speak to a little bit of pre-existing conditions that people have and the effect of the vaccines, and also fertility, pregnancy, breastfeeding. Can you speak to any and all of those?
So the short answer is we probably don't have enough data to give firm answers in any of those areas. As I think I mentioned earlier, Pfizer is working on a vaccination, a study including pregnant women. And the main concern is, will it affect the pregnancy, will it affect the fetus? And that's why, the recommendation is if you're pregnant or plan to become pregnant soon after the vaccine, to talk to your family doctor to go over the limited information out there. I think the general consensus, though, sort of in the medical community, is that it's probably going to be safe. But if you're reluctant, you could wait for more data. And to be honest, if you looked at the rollout plan, phase 3 doesn't come till August. So if you're a relatively healthy woman who is pregnant, you may not even have to make that decision till August. And I'm expecting that there'll be a lot more information about pregnancy and vaccine safety in pregnancy by then, because things are moving very fast. And like I mentioned, the Pfizer study on pregnancy is ongoing. With fertility, I'm not sure if there's a good answer for that. I don't think people expect to have an issue with fertility, but it's not something that's specifically being studied right now. In a pandemic, we're just sort of making sure it's safe for all people, but I don't think there's an expectation that it'll affect fertility.
Thank you.
Thank you. And there's just one more person with their hand up. Melissa, yeah.
So I'm currently pregnant. I'm 38 weeks. And I'm just wondering if I go to the hospital, I catch COVID, am I still allowed to breastfeed? Does it affect me giving my baby the COVID? Like, how does it work? Or I should just plan to give formula from right away?
So that's a great question. I don't actually know off the top of my head what the current recommendation is for breastfeeding moms who are who develop COVID-19. So I don't want to lie to you and give you advice one way or the other. You probably should check with your family physician after you've given birth or when you get diagnosed with COVID-19, and they can probably look it up or liaise with Toronto Public Health to find out the firm answer on that. So I'm sorry, I don't know the answer to that. I'm so sorry.
All right. Thank you so much. There should be some time at the end for more questions, but I want to move on to our next speaker. Our presenter was Dr. Dannielle Nicholson-Baker, who has worked for 16 years in healthcare as a registered nurse and a naturopathic doctor. She has helped many women and families in her practice with various health conditions. She has run her practice in Brampton and Jane Finch and the Albion communities for the past 10 years. He's also helped women and men to support healthy lifestyle through conducting workplace wellness sessions. Dr. Dannielle currently works at the Region of Health in Peel, in the Chronic Disease and Injury Prevention Division, supporting the COVID-19 pandemic response. She's a member of Agape Ministries, one of the churches in Jane Finch Church Coalition. It has been said that an ounce of prevention is worth a pound of cure. Well, Dr. Baker is now going to share how a gram of prevention is worth more than an injection of vaccine. So Dr. Dannielle.
Thank you very much, Pastor Audley, for that introduction. So I'm just going to share my screen here. Let's see. All right, so is everyone seeing that there? Okay, great. So I'm going to continue here. So essentially, my section here has to deal with sort of what are some of the things that we can do to maintain our physical health, our mental health, our spiritual health in the midst of the pandemic, in the midst of a lot of the concerns you know, that we may have with regards to COVID-19 and with the vaccines as well. And so one thing I do want to start off with, and I know that Dr. Liu did allude to it as well, has to do with how our body responds to the virus and if we are exposed to the virus. So the first thing to note is that there are certain protective barriers that we have. So we have with our skin, our airways, our mucosal membranes may help to trap some pathogens from entering into our system. And then when we look at just even the public health measures that have been put into place, so wearing the masks and shields and the hand washing, all of these are what we call protective sort of barrier methods that have been put in place to protect us. And so these are definitely things that I would encourage, and I know many of you have been doing that, and encourage you to keep on doing that, because that is sort of our first line of defense to protect us from acquiring or developing the virus if we follow through with these. And then looking at, well, you know, if we are unfortunate, the virus, you know, be exposed to it and the virus is able to get past these defenses, then our body does have two ways within which it would sort of respond. And so the first is with our innate immune system, and then the second is adaptive. Innate is essentially our ability to, that sort of first line of response for our body to recognize a foreign invader, such as a virus or bacteria, and sort of the immune system is then activated to then deal with it. And then the adaptive immune response is such where once our body has seen it and it recognizes it, it's then going to now initiate and create these antibodies to then better deal with that invader when it's exposed to it again. So I am going to be focusing a little bit on what are some of the things that, despite, you know, whether you have the vaccine, you don't have the vaccine, these are just sort of healthy sort of tips. And I've just put it in an acronym there as healthy, just to help guide the conversation today, that I would encourage each and every one of us to apply to our lives. And I'm just going to sort of connect it to our immune system. And it's not in any way a replacement, or you do this and you don't do other things, but it's just more to enhance or to support our body to be able to function better, so that it can be in its best space possible, whether it is an exposure to COVID-19 occurs or not. So the first has to do with hydration. And so our immune system is highly dependent on nutrients. It's highly dependent on oxygen to get to the cells, and water and the fluid within our body is what is necessary to be able to transport these nutrients, to transport oxygen to the cells, including our immune cells that need it. It is necessary and necessary for building blocks for the proteins and some of the chemical reactions that our body will have to do in order to fight viruses that it's exposed to. Specific to our immune system, we have to take a look at our lymphatic system, which is part of our immune system. And it does, our lymph, which is fluid that essentially sort of circulates around the body, is reliant on our water intake as well. And our lymph essentially is there to, you know, produce and to monitor for invaders, to destroy some of these invaders, and then to help filter it out of our system. So if we are sometimes even mildly dehydrated, it can impact on our overall immune system's ability to be able to fight off viruses and be able to deal with it better. So Canadian data suggests that even though 97% of us agree that the best way to rehydrate ourselves is through water consumption, only about 50% of us are actually drinking enough of water to be able to have that significant effect. And that's roughly about 2 to 3 liters of water for the average person. And a lot of what I'll be saying are general recommendations. And then if there's anything specific, as far as any health conditions that you have, then you definitely want to take that back to your healthcare provider, your family doctors, to be able to get some better direction on. The second part I want to touch on is on eating well. And again, we're going back to nutrients, nutrients that are critical for the growth, for the functioning of these immune cells, so that when they're encounter an invader, a pathogen, such as a virus or bacteria, they're able to best respond to it. And so certain vitamins, such as vitamin C and D and zinc, they're just sort of the building blocks of some of these reactions and these the production of some of these proteins that are needed for your immune cells and for antibodies to function. So the main goal really is not necessarily sort of highlighting a specific nutrient or ingredient and saying you have to have a certain amount of this particular one, but it is really looking at your dietary patterns overall. So what does it say about you? Like, are you looking at, are you consuming foods that are being nourishing to your body and being able to provide those building blocks that's needed? Another important factor for looking at your diet is looking at what we eat really plays a significant role on the microorganisms that live in our intestines. And we may think, well, why is that significant? And that is significant because growing research is showing that these microorganisms within our intestines can indeed stimulate our immune system, and it impacts the way in which our immune system functions. Because the majority or a lot of our immune sort of functioning in cells actually do reside within our intestinal tract. And so it is important then to ensure that the foods that we're consuming, they actually act as almost like food for these microbes, and they're, you know, good bacteria, good viruses that the body would need to function better. And then there are those that are not as helpful. So the food that we take into us helps with making sure that that balance is there, so that we don't have any negative or sort of health effects that can occur as a result of not having the nutrients that our body needs for it. So what does that look like for some of us? Well, I shouldn't say some of us, for all of us really, should be that of a high in fiber, high plant food based diet. So fruits and your vegetables, whole grains, legumes. And again, all of these are important for the support, the growth, and the maintenance of these beneficial microbes. And looking at our Canada Food Guide, that is a very good place to start, as you would find lots of great recommendations there in terms of these whole foods, and also the recommendation there for having sort of water consumption as your main beverage choice. And so the A here stands for being active. And as one researcher put it, acute exercise is an immune system adjuvant. And based on his research, he was able to see that sort of incorporating habitual sort of exercise into your overall life is going to enhance the way that your body's immune system functions. Epidemiological studies we're looking at sort of, again, that habitual exercise and looking at that immune regulation. And what it also found is that it delays the onset of age-related dysfunction. So we do know that as we get older, our immune system may not function as well as it should. And what it's showing here with the study is that the habitual exercise can actually sort of delay that sort of age-related dysfunction that can occur as a result. So then our immune system functions better for longer as we get older. Statistics Canada indicates that only about 16% of Canadian adults are getting the recommended amount of physical activity. That means that about 84% of us are just not moving enough. And so Heart and Stroke Foundation in Canada is recommending at least 150 minutes of moderate to vigorous, intense aerobic physical activity, which can be done in bouts of 10 minutes or more. So it doesn't mean you have to do a half an hour stretch or 45-minute stretch. It may just be when you have 10 minutes within your day, doing a 10-minute workout and then coming back again and doing another 10-minute workout. And that overall, accumulative effects can be as beneficial as if you were doing a 30-minute exercise. So losing the stress. So the L is for losing the stress. And again, research is showing that excessive and repetitive stressors are what is sort of weakening our body's immune system. So not the sort of quick stressors and where we have to escape a particular situation or whatnot, and then our body has time to recover. This is looking at areas where we're just chronically stressed. And I mean, we can say that within this pandemic and all of the things that we've had to deal with, does have the ability to create some of these chronic stressors, physical and mental stressors for us. And so it is taking a look at of that and what are some things that we can do. And there are two things that I wanted to highlight with that. And the two are, one, just a practice of gratitude. And this again is another growing area of study where we're showing that people that either practice gratitude, and that's just being grateful for the things that we have. There is an increased level of, they tend to be more optimistic about their overall just life and the outlook of life. And so the studies are showing the connection between optimism and an increase of serotonin and dopamine, and we call some of these your happy hormones. It helps to reduce the cortisol, which is your stress hormone, and it helps to maintain sort of the blood cells, the white are in our immune system. So one thing I want to make note is, don't avoid it. If there are any sort of stressful situations or thoughts or anxiety that we're experiencing, the goal really is to not suppress these thoughts, because I think it's almost safe to say that it is normal to have a certain level of stress and anxiety during the past year that we've had. But you want to be aware of it. You want to accept it. You want to be able to say, okay, what can I do to change it? And then seeking out the necessary resources to deal with it, whether it be self-care, whether it be just being mindful about being in the present, whether it be through your faith and being God-centered. And then I just want to highlight sort of two areas here of additional support. So these are two free virtual health supports where they are guided by registered therapists and referred from your family doctor, where you can get sort of a more in-depth support. There are some specific criteria for the support. The bounce back is a little bit more general, where you don't necessarily have to be diagnosed with a specific condition or whatnot to access it, but just know that there are free supports that are out there for you to reach out if you find that your ability to manage the stressors is not as well as you'd like it to be, and it's affecting your daily life. And then the last two here, so we've talked about Thanksgiving and gratitude. And then the last one here has to do with sleep and having sufficient sleep. And we do know that sleep deprivation long-term does have an impact on your immune system, specifically your innate immune systems, your ability to respond initially to an invasion or a foreign invader within the body. And there's just one study I wanted to highlight that showed that there was two groups of people with that were exposed to the common cold, one that had more than 7 hours of sleep and the other one that had less than 6 hours of sleep. And what the research showed was that the group that got less than 6 hours of nightly sleep for a week before the exposure were 4 times more likely to be infected than the group that was getting 7 or more hours a night of sleep. So just highlighting the need for getting sufficient sleep. It could be quite easy, if many of you are at home and maybe working from home and just not getting out as often, then sometimes our sleep patterns may be shifted. So just reflect on that and ensure that you're getting adequate amounts of sleep. And it's not just the one-off nights where you maybe a challenge with that. It's really the chronic sort of sleep deprivation is what we're looking at here that can have sustained impacts on your immune system. And then finally here, the why really is for you, right? So I think just by you being here tonight, you're getting yourself educated and informed by all the information that's being presented tonight. And just know that you have you have an ability to change. Like if the environment, if there's some things we can't, and that must be said, yes, and there's a lot that, you know, a lot of our control has been not necessarily there, the things that are out of our control, but there are some things that you do have control of. And it's really just kind of empowering each and every one of us tonight to know that there are things within our control. And one is just by being here, getting the information and making certain actions and decisions as a result. And the final bit here is really just focusing on some scriptures. And I probably would just, you know, it's looking at faith in God, faith in science, faith in yourself. And I say faith in science because sometimes we think that, you know, we can't have both, right? You know, we have faith in God, but then, you know, what does the science say? But they're not mutually exclusive. You can have solid faith in God, and you can also have faith in the science and the evidence that's there. And then just faith in yourself, right? That you're able to acquire information and to act on the information, and then faith that you can see the outcomes of your actions. I say here there's no place for chronic fear, because, you know, that's where the detrimental effects can occur within our lives, and you have to be mindful of that. A few scriptures here, Matthew 6:34, do not worry about tomorrow, for tomorrow will worry about itself. I think if you have enough for one day, you know, park it, get a good night's sleep, and then, you know, pick up again the next day. Philippians 4:6-7 says, be anxious for nothing, and really just letting the peace of God that will transcend our heart and mind. When our thoughts are anxious and they multiply within me, your comfort delights in me. And it just talks about the Holy Spirit and how he can comfort us when we are anxious and when our thoughts increase. And then anxiety in a man's heart weighs it down, but a good encouraging word makes it glad. So this is really just a call out for, you know, and I think we've all been sort of doing this throughout the pandemic, but just reaching out to others and calling. If you haven't heard from someone in a while, yes, we're not able to physically connect, but being able to just reach out and share an encouraging word as we're all going through this. And then the final verse here is Psalm 91, 1-16. And I've just highlighted a few pieces here. And I know many of us are very familiar with these scriptures, but just knowing that, you know, you can rest despite a lot of what's going on around us, that there is a possibility to have peace within our lives, despite the situations that occur around us. And so with that, I will end. I know that it's sort of a quick sort of tidbits on some of these sort of lifestyle things that we can do, but I hope that some of it was helpful for you.
Okay, thank you so much, Danielle. We have a few minutes for questions, particularly for this presentation, and then any general ones. So please.
I do see something in the chat here. Someone's asking that they generally can't sleep beyond 5 to 6 hours. They wake up. Do people need different? Do different people need different amounts of sleep? I guess is the question.
And to that question, I would say yes, that there are various numbers of hours of sleep that we need, and some of that is dependent on our age and the stage of life that we're at. Some of it may depend on the stressors and our day-to-day activities, you know, so yes, there are variances to that, but I would say that if there are any disturbances, because ideally we want to get sort of a solid night's sleep where our body's able to go into that deep sort of REM state, because that's where a lot of the healing, a lot of the restoration occurs when that happens. So if that is a concern, then I would definitely say reach out to your healthcare provider, your family doctor, to be able to get some sort of feedback on what may be causing some concerns there.
I think, Audley, maybe at this point we can launch another poll. We've been given some great information over the last hour and a half or so. And so Michelle, maybe if you want to launch the poll again, and we can see where people's thoughts are at. And feel free again to continue putting your comments in the chat.
Okay, so I've launched the poll now, and this question again is the same as beginning. So if you were offered the COVID-19 vaccine right now, will you take it? Yes, no, or you're still not sure. Just so you can just pick your answer and then just hit submit. Cheryl, I'm not sure if you can help me monitor the responses. Great.
Yep. We're seeing the numbers are going up. We've got about 45% so far of attendees. 48% of 90. So we've got about half of the folks answering.
Okay, we've got another couple of questions coming into the chat as well we can address after.
Or why don't we address them now while we wait for those people who are not hitting the buttons as quickly.
Okay, so one of the questions is a follow-up along the lines of sleep. What should you do if you wake up at night and cannot immediately go back to sleep?
So there are many thoughts on that, and some are that, you know, if you're not able to immediately go back to sleep, then get up, you know, go outside, you know, do something else until you're kind of ready to sort of go back. And when I say ready, meaning that you're saying, I'm now going to sort of make another attempt to go back, because there are thoughts that, you know, if your body's not in that sort of frame of mind to go to bed right now, then you almost want to shift from that. For some people, doing things such as, you know, drinking teas, there's magnesium within milk sometimes, like a warm beverage may be helpful to sort of get the body back in gear. It depends on the reason, right? For some people, it may be the thoughts are just running. And so what do I do with that? Do I write some things out or journal? Do I, you know, just to get the thoughts out of my mind so now my thoughts can settle a little bit, right? So again, if it's something that's more chronic, we may need to look into what else may be causing some of those concerns. But in the interim, you can try sort of different things, making sure that there isn't sort of the lights with the cell phones and our clocks and TVs and whatnot, because again, there's research showing that some of these lights can impact our ability to sleep. So there are a number of different things that we can take a look at to help you to get back to sleep at that point.
And then there's a question about liability from drug companies. If vaccines are safe, why are the vaccine companies exempt from liability? I don't know who wants to take that one.
Yeah, I can comment on that. The assumption is that when you get a vaccine, you are making a decision based on the best information that has been provided to you, and that's correct information. So you take on a certain amount of responsibility. So it's not that the vaccine companies are off scot-free at all. I think that if there was reason to think that there was something wrong in the development of the vaccine, that it had, for whatever reason, there had been information that was not provided. There's no big indication that that is the case. But if for some reason that were the case, then the vaccine companies would still have some degree of liability.
Thank you. I don't know if there are others.
I think there's another question that just came through. Why have some people experienced paralysis since taking the vaccine? So I know there's been some things, some reports of people getting called, you know, Bell's palsy and other types of physical side effects.
So the paralysis that people have talked about is Bell's palsy, and basically it just affects you know, half of your face, and the important thing is that when the regulators like the European Medicines Agency, the FDA, and Health Canada have looked at the data, it really does appear so far that the risk of Bell's palsy from COVID itself doesn't seem to be any lower than what was observed in the vaccine, or even just having Bell's palsy from just, you know, reasons that are totally unrelated to the vaccine. So it doesn't really appear so far that it's a true signal that is related to the vaccines. But the way that side effects are monitored once people get vaccinated is that any event that happens is tracked and should be tracked just to make sure that it is not related to the vaccine. So for example, if you got vaccinated and you're on your way home, you were in a car accident and you got admitted to hospital, that would be captured and we would be evaluated to see if any way it could have been related to the vaccine.
And I think there is a follow-up, but I'm also aware of the time. And maybe Dr. Nicholson-Baker, can you respond to, are there natural medicines that can be taken as alternatives to the vaccine?
Yeah, so no, there isn't. The vaccines and vaccination is still sort of the standard sort of procedure with regards to dealing with the pandemic, dealing with certain viruses and bacteria. There are things, as I mentioned, that we can do to sort of support our immune system and how it functions. But no, there isn't any evidence of any specific natural supplement or alternative or anything like that that would be a replacement of taking the vaccines.
Okay, great. Thank you so much for answering the questions and for all that put questions in the chat. We will do our best to we will be posting the live stream to this session, as well as hopefully try and get some of the answers to your questions that were not answered this evening. I know that, I think it's great that we've had this opportunity to look at the science of the vaccine, to look at how we can, look after ourselves spiritually, both mentally and physically. And just wanted to also just end, before passing it back over to Audley to have a final word, just to share the results of the poll, of which 70% of you answered the questions this time. If you were offered the COVID-19 vaccine right now, will you take it? Compared to, compared to 34% who answered yes at the beginning of the session. It's now 48% that answered yes. Those of you that answered no, before it was 14%, and now it's up to 19%. So a few have decided no. And the biggest change was those that were unsure. At the beginning, at 54%, the percentage is now down to 33%. So clearly there has been, our speakers have imparted some knowledge and information that has shifted some thinking. And again, this in no way are these sessions meant to tell people what to do. You really have to get the information, check your facts, and as I think was made clear this evening, check with your healthcare providers, get the right information, because there's lots of misinformation out there, but there's also lots of really great sources of facts shared on websites, and the slides will be available from this session, and we just hope to continue this conversation. Just wanted to really, again, thank all of our speakers, as well as our staff and background support, Ruth, Michelle, everyone for supporting this, and I'll now turn it back to Audley.
Thank you, Cheryl, and your staff at Black Creek Community Health Center for helping to make this possible. The Jane Finch Church Coalition, we are so pleased that you are able to come on board. Almost 90 of you were able to participate, and we are thankful for that. And of course, we are so thankful for our presenters, Dr. Allen, Dr. Liu, and Dr. Dannielle Baker. We thank you for your expertise and what you shared. And we trust that you are better informed now to make a decision, one way or the other. Ultimately, we hope that you go forward in faith, not in fear. And this is all part of helping you to live and cope in the midst of COVID, and trust that we will be able to get through it together and come out stronger and better. And so we hope you will be able to take what you've heard. As has been said before, if you want to have a replay of this recording, it will be up. Whoever contacted you about it can give you the link. The respective churches will have a link as well. So thank you so much, each one, for being part of this time. It has been very profitable, and we appreciate your input and your participation. Thank you, and God bless you.
Thank you.
Thank you.
Thank you.
Sure. Happy International Women's Day to all the ladies here. I forgot. Okay.
Thank you.
Thank you. Same to you.
Thank you for all these ladies, what you do for us.
Thank you very much.
Thank you.
Right.
Good night.
Okay.